Christina. I'm a CLC nursing student. I'm going to be your nurse today. I'm going to close the door, wash my hands, give you some privacy. Can you go ahead and just state your name and your date of birth for me? Phyllis McCracken. Phyllis McCracken. Okay. Date of birth 317XX, 317XX. Okay, great. And then your MR number is 2345. MR number 2345. Okay, very good. Well, how are you feeling today, Miss McCracken? You're having some trouble peeing? Yeah, I heard. So the doctor actually gave you an order to insert an indwelling urinary catheter this morning. So I'm going to go ahead and do that. Before I start, I just want to take a look at your bladder. So I'm going to just pull up your gown. Yeah, I can see your bladder is pretty distended, and when I press on it, it's very firm and hard. You feel like you have to pee, but you can't. Okay. Before I get started with the procedure, I just have a question if you have any allergies, if you're allergic specifically to iodine or shellfish. Okay, no? Perfect. So this is a sterile procedure, so I'm going to normally have the bed raised up to waist level, and then have my kit on the table next to me, waist level, and I wouldn't turn my back on the sterile field, so that way it's not contaminated or anything. I'm going to position you in dorsal recumbent position, so you're going to be flat on your back, and your feet are going to be on the bed, so your legs are up, so that way your vaginal area is exposed, and I can see. Okay, so I'm going to wash my hands. I'm going to raise the bed up to waist height. I'm just going to get down. Okay, so I'm going to open my kit. So right here is my indwelling urinary catheter. So I'm going to open up the kit. Use this as a garbage bag. I'm going to place this down here, and then I'm going to open this up 1 inch. So first I'm going to put on my surgical sterile gloves. So I'm going to open up away from me, and then open like that. Okay, there we go. So first I'm going to do my dominant hand, Miss McCracken, and just slide it in like that. And then I'm going to reach inside the cuff and just slide my hand in. And once they're on, I can adjust them in any way. So there we go. Next, this is my drape. So I'm going to, once again, open away, up, okay, and then go like that, and then once it's down I can adjust it, and then the same thing with this one. I'm just going to lay this down here so it's extra. Okay, so now I have my drape set up. I can touch inside my kit because my gloves are sterile. So I've got my iodine swabs, a tray with the sterile water to inflate the catheter, and then my catheter. So first I'm going to clean the vaginal area. So I'm going to clean the outside first and then the inside. So I'm just going to go the outside down, throw it away, the outside down, throw it away, and then we're going to do down the middle. Okay, so I can throw these away now. And then I've got my lube right here. So I'm going to just dip my catheter in it to get it nice and lubricated. Okay. And then I have my sterile water that I'm going to put on the catheter so that once I insert the catheter, I can blow it up. Okay, so how are you feeling, Miss McCracken? Okay? All right. This should not hurt. You shouldn't feel any pain. You might feel a little bit of pressure, and it's probably going to be cold. So let me know right away if you have any pain. Take some nice deep breaths for me, and we're going to get started. Okay, so I'm going to hold open the labia with my hand so I can see the urethra, which is right there. And then if you have a hard time seeing the urethra, I could ask you to cough for me. Can you cough for me, Miss McCracken? Okay, see? Okay, now I see the urethra. So I'm going to go ahead and start inserting. And then I'm going to insert this catheter until I see urine coming out of the tubing. So let me insert it. Okay, so I see the urine flowing from the tube. And then once I see the urine, I'm going to insert it a couple more inches. Just to make sure that it makes it inside the bladder out of the urethra. And then once I insert it a couple more inches, I would inject the sterile water. I'm not going to actually do it because this is a shoebox or a tissue box. But I'm going to, let's say I inject the sterile water into the catheter. And then I should be able to tug on it and feel resistance to know that the balloon blew up and that it's inside the bladder. So I can take this off. That's done. And then I would have a leg strap that I can Velcro this to the person's leg so that way it stays in place. Okay, so I've inserted the catheter. How are you feeling, Miss McCracken? Yeah, it looks like I can see the urine's flowing and your bladder looks a lot less distended, so that's really good. So while I'm here, actually, I'm going to just get a urine sample from you. So I have my urine sample cup. And since this is already sterile, I can just go ahead and do this right away. I would just open this up, put this inside the cup, and just push that open and obtain the amount of specimen that I need, just like 10 milliliters or something. Okay, and then I'm going to close this. Insert that back in there. And then I would sign and date this the day that it was collected. So I'm going to sign and date it. And then that's good to send off to the lab. And then I'm just going to make sure this is placed below her so that way the urine can drain. Okay. How are you feeling, Miss McCracken? I actually, well, first I'm going to clean up all my stuff. So that way it's clean. And then put this in the garbage bag. Take my gloves off. Wash my hands. Throw that away. Wash my hands. Okay. How are you feeling, Miss McCracken? I see that the urine isn't draining anymore. And your bladder looks pretty distended. You feel like you have to pee, but you can't? Okay. Yeah, I see that. Well, I actually have an order from the doctor here to irrigate the indwelling catheter intermittently with 30 milliliters of saline as needed. So I'm going to go ahead and irrigate your catheter so that way it can flow. So I'm going to wash my hands. I have my irrigation tray right here. I would put on non-sterile gloves because this isn't a sterile procedure. So I've got my gloves on. I would pour some normal saline in here, so I'm going to pour some in there. I've got my syringe here, 30 milliliters, so I'm going to, sorry I touched my hair. I would actually have to take my gloves off, wash my hands, and put new gloves on. So I'm going to get 30 milliliters of normal saline to irrigate. Okay, 30 milliliters. And then you push that in. Okay. I'll take my gloves off, or we'll put this away first, then take my gloves off and wash my hands. How are you feeling, Miss McCracken? Is that better? Yeah, it looks like the urine's flowing again, and your bladder is a lot less distended, and it's not as hard. It's nice and soft. Okay. Well, I'm going to put your call light right next to you, give you some water. If you need anything, go ahead and hit your button, okay? And I will see you later. Okay, thank you so much. That's it.